Now we talk about acute sinusitis and chronic sinusitis. Acute sinusitis, as you can see in the picture, we have got four groups of sinuses. The maxillary sinuses, the largest ones, then the frontal sinuses, then there are small anterior, middle, and posterior ethmoid sinuses, and there's sphenoidal sinuses. Definition of acute sinusitis: acute inflammation of the sinus mucosa. Now, sinusitis can be unilateral or bilateral, and it can involve either one sinus at a time or multiple sinuses. And then, if it involves multiple sinuses, multiple sinuses, it can be called multisinusitis, or it can be called pansinusitis. It can be bilateral or unilateral. Here's a picture showing the sinuses in patients. Infected pus-filled maxillary sinus shown yellow in color. Normal maxillary sinus mucosa is pinkish in color. Whereas frontal sinus here is shown above the eyebrows immediately, both sides. What is the etiology of sinusitis? Why does it occur? Existing causes like nasal infection occurring in a patient may spread towards the sinuses and lead to sinusitis. Swimming and diving, in cases of nasal infections, or swimming and diving may lead to spread of infection. Trauma to the sinuses occurring later on, secondary infection in the sinuses can lead to sinusitis. Dental infections sometimes lead to sinusitis because one knows that the upper second premolar and upper first molar, the roots of these teeth are usually related to the floor of the maxillary sinuses. And infection in upper second premolar especially may lead to spread of infection to the maxillary sinuses. Certain predisposing causes of sinusitis can be obstruction to the sinus ventilation and drainage due to nasal packing, due to deviated nasal septum, due to hypertrophic turbinates, due to edema of sinus ostia, due to nasal polyps, or structural abnormalities. They are all causes of obstruction to the sinus ventilation and drainage. Other causes like stasis of secretions in the nasal cavity due to cystic fibrosis or due to enlarged adenoids and choanal atresia lead to secondary infection to the nasal cavity, secretions, and this can spread to the sinuses. And the third cause predisposing factor is previous attacks of sinusitis. General environmental causes like poor general health. And now, bacteriology, what causes sinusitis? Usually the bacteria which are the culprit is Streptococcus pneumonia, H. influenza, Streptococcus pyogenes, Staph aureus. These are the usual organisms. What is the pathology? There's usually congestion, hyperemia, exudation of fluid in the sinuses, there's outpouring polymorph nuclear cells, and increased activity of serous and mucous glands. And now, depending on the virulence of organisms, defenses of host and capability of sinus ostium to drain, exudate, the disease may be mild or severe. Now, severe infection causes destruction of mucosal lining. This failure of ostium to drain results in empyema of sinus and destruction of its bony wall. Dental infections are very fulminating and soon result in suppurative sinusitis. Talking about acute maxillary sinusitis now. Sources of infection to acute maxillary sinus infection is most commonly caused by acute rhinitis infection. Sometimes source can be from the pharyngeal infection. Sometimes dental infection may lead to it. Others, swimming and diving in contaminated water can lead to acute maxillary sinusitis, whereas trauma is another cause directly to the maxillary sinus. Here's the maxillary sinus, inflamed, showing the ostium, which is swollen and narrowed. Predisposing factors to acute maxillary sinusitis can be due to obstruction to the maxillary sinus ostium due to anatomical reasons in the nose, like nasal polyps, DNS, infections, or infective or allergic, like polyp, and tumors in the nasal cavity, leading to obstruction of the nasal mucosal ostium of the maxillary sinus. Stasis of secretions in the nasal cavity and previous attacks sinusitis are other reasons for getting a sinus infection. Poor general environment like cold and wet climate, smoke and dust, and overcrowding can be other leading or predisposing factors. Poor general health like patients suffering from measles or whooping cough or chicken pox and nutritional deficiencies, or patients suffering from diabetes or immune deficiencies may get sinusitis. What bacteria? We have already said about bacteria causing it. Most common organism causing acute maxillary sinusitis is Streptococcus pneumoniae, which is in 48.2%. Haemophilus influenza is the next culprit, and other organisms 9% approximately. Viruses which can cause acute maxillary sinusitis can be rhinovirus, adenovirus, Coxsackie influenza virus, and parainfluenza virus. Same viruses which cause acute rhinitis or common cold can lead to acute maxillary sinusitis as well. What are the clinical features of acute maxillary sinusitis? There are constitutional symptoms like fever, malaise, body ache, headache, pain in upper jaw, referred to the gums and teeth, tenderness over the maxilla, fleshing, swelling, or redness over the maxilla, and nasal discharge, which can be visible is on anterior rhinoscopy and posterior rhinoscopy. What investigations we can do in acute maxillary sinusitis? This transillumination test. Affected sinus will be found opaque on transillumination test. Whereas X-ray of the maxillary sinus, which is usually Waters view, also called occipitomental view of the sinus, it shows opacity or fluid level in the maxillary sinus. Differential diagnosis of acute maxillary sinusitis is from dental neuralgia, pain occurring due to tooth problems, usually do not lead to nasal discharge and tenderness over the maxilla and so on. So one can differentiate from them. X-ray also shows problems with the teeth. Now, temporomandibular joint neuralgia, there's tenderness over the joint itself, and there is pain on chewing as well. And there's no signs of nasal discharge and nasal obstruction and so on. Atypical facial pain can also occur due to just the facial problems, migraine, Certain nasal pharyngeal tumors must be differentiated from acute maxillary sinusitis as well. How do we treat acute maxillary sinusitis? Basically, because the sinusitis usually bacterial, we try antimicrobial drugs like broad spectrum antibiotics, ampicillin or amoxicillin or erythromycin and cotrimoxazole. Then we give nasal decongestant drops to um, open up the ostium of the maxillary sinus and let it drain well. Then we give steam inhalations as well and analgesics and hot fermentation to the affected sinus. Surgical treatment of acute maxillary sinusitis is in the form of antral lavage, which is antrum washout. It's also called antrum washout, and another name for it is PROF puncture. But this antral lavage or PROF puncture is reserved in cases who do not respond to medical treatment. We do not go for surgery in acute maxillary sinusitis from the very start. We usually try medical treatment. If the medical treatment fails, or if the patient is seen to develop complications, then we go for an antral lavage, because in acute cases there is the danger of spreading the infection. Complications of acute maxillary sinusitis can be subdivided into acute or chronic sinusitis. It can either develop chronic sinusitis due to acute. Now, frontal sinusitis may also develop in acute maxillary sinusitis cases. There can be osteitis or osteomyelitis of the maxilla. And the dangerous complication, another one, is orbital cellulitis or orbital abscess. Now we conclude. Now, talking about acute frontal sinusitis, it is an inflammation of frontal sinus mucosa. Frontal sinus is above the eyebrows in the frontal bones, one on either side, usually with a septum in between. Its etiology, it's a viral infection of upper respiratory tract followed by bacterial invasion. Swimming and diving is another cause of causing frontal sinusitis. External trauma to the frontal sinus, like fractures or penetrating injuries, can lead to sinusitis. Edema of middle meatus secondary to associated maxillary or ethmoid sinus infection can lead to frontal sinusitis by spread of infection via the duct of the frontal sinus. Clinical features of acute frontal sinusitis: it can be fever, headache, malaise, unpleasant taste, and pain. Frontal headache is severe, localized, showing characteristic periodicity, also called office headache, tenderness over the sinus, edema of upper lip, and nasal discharge. Now, what is office headache? Now, this is a special type of headache which usually starts in the morning, and when the office time starts, like 9 o'clock in the morning. And it usually goes off, the pain relieved, usually in the afternoon. That's why during the office time, it's called office headache. Now, why does it occur during that time? This is in brief, that frontal sinus has got a dependent drainage. When the patient is having frontal sinusitis, in the lying position, when the patient is in the sleeping position, then the frontal sinus is not discharging to the middle meatus. Now, when the patient becomes upright in the morning, When he wakes up, he becomes upright and walks about. The frontal sinus tries to drain the secretions which have collected inside the sinus during the night time. Now, these secretions apply pressure for drainage through the ostium of the frontal sinus, but because the frontal sinus ostium is blocked due to infection, it does not drain, and the pressure builds up in the frontal sinus and gives rise to headache. Now, this headache eventually cleared, it gets worse about noontime, then gets eventually cleared because there is slow drainage through the ostium of the frontal sinus, and this slow drainage leads to clearance of the sinus in the afternoon. Investigations for frontal sinusitis again is blood CP and culture sensitivity and X-rays, especially Waters and lateral view, as well as an occipitofrontal view showing the frontal sinuses. How do we treat frontal sinusitis? Medical treatment: antimicrobial drugs like ampicillin, amoxicillin, erythromycin, nasal decongestant drops, analgesics, antihistamines with oral nasal decongestants. Placing cotton soaked in vasoconstrictor in middle meatus. Now, we continue the treatment for about 10 days or 2 weeks if symptoms are improving. Surgical treatment of acute frontal sinusitis is again in those cases where medical treatments fails or there is abscess collection in the frontal sinus which is not draining. So what we do, we do terfination of frontal sinus or antral lavage. Complications of acute frontal sinusitis can be orbital cellulitis, osteomyelitis of frontal bone, Pott's puffy tumor, meningitis, extradural or frontal lobe abscess, chronic frontal sinusitis. Talking about acute ethmoid sinusitis, etiology is similar. It's associated with infection of other sinuses and more often involved in infants and young children. Acute ethmoid sinusitis is more common in infants and young children. Typically in it, the clinical features of acute ethmoid sinusitis, there is pain over the bridge of the nose, there is edema of lids, increased lacrimation, nasal discharge, and swelling of middle turbinate. Treatment of acute ethmoidal sinusitis, medically again, antimicrobial drugs, nasal decongestant drops and analgesics. Surgical treatment of acute ethmoidal sinus disease in cases of chronic collection of pus in the ethmoid sinuses and the ethmoid sinusitis not getting better, then external ethmoidectomy incision is given and the sinus drained. Complications again, orbital cellulitis and abscess, visual deterioration and blindness, cavernous sinus thrombosis and death, extradural abscess, meningitis, brain abscess, etc. Acute sphenoid sinusitis is less common as compared to other sinus disease. It's part of pansinusitis usually. Now, associated with infection of posterior ethmoid sinuses as well. Now, clinically, it gives rise to headache, which is localized to the occiput or vertex. Post-nasal discharge is also there in its clinical features. Investigations by X-rays and CT scans. Differential diagnosis of acute sphenoid sinusitis is mucocele of sphenoid sinus can mimic acute sphenoid sinusitis, and neoplasm may also give rise to symptoms of acute sphenoid sinusitis disease. Now, treatment is antibiotics, decongestants, and analgesics. Thank you very much.